Hello, I'm a certified surgical technologist, and I would like to invite you to learn more about the fast-growing profession of surgical technology. During this presentation, I will try to answer your questions about beginning a career in surgical technology. Would you like to become a part of this exciting surgical environment? Would you like to contribute your talents to taking care of others? If so, a career in surgical technology may be right for you.
What is a surgical technologist?
A certified surgical technologist, a CST, is an allied health professional who works as part of the surgical team to ensure that surgical procedures are performed under safe and sterile conditions.
Who are the members of the surgical team and what are their functions?
Surgical team members function in two capacities, non-sterile and sterile. The non-sterile team members are the circulator and the anesthesia provider. In certain situations, other personnel, such as the radiology technologist or pathologist, may also be in the operating room. The circulator is a registered nurse, a licensed practical nurse, or a licensed vocational nurse. Some of the circulator's duties include interviewing the patient before surgery, transporting the patient to the OR, transferring the patient to the OR table, assisting the anesthesia provider, preparing the patient's skin for surgery, connecting various cords and tubings, providing additional items to the sterile field during the procedure, maintaining the patient's operative record, and preparing the operating room for the next patient. The anesthesia provider may be either a physician or a certified registered nurse anesthetist. Some of the anesthesia provider's duties include administering the anesthetic, monitoring the patient's vital signs throughout the procedure, and providing other support during the surgery. The sterile team members are the surgical technologist, the surgeon, and the surgical assistant. The surgical technologist functions in a sterile capacity during the surgical procedure, but also performs many non-sterile duties throughout the course of the workday. The main responsibilities of the surgical technologist are preparing the operating room, assist with positioning the patient, creating and maintaining the sterile field, entering the sterile field and assisting team members as they enter the sterile field, organizing the sterile instruments, equipment, and supplies for use, preparing the patient's skin for surgery, assisting the surgeon in placing sterile drapes on the patient, assessing and anticipating the needs of the patient and the surgeon throughout the procedure, and providing the necessary items in the order they'll be needed, and covering the incision with a protective dressing once the surgery is finished. The surgeon performs the necessary procedure. The surgeon may be a medical doctor, doctor of osteopathy, doctor of pediatric medicine, or a doctor of dental science. The surgical assistant may be a physician or non-physician. The duties of the surgical assistant include making sure the surgeon has a clear view of the surgical site through retraction of tissue, suctioning, and sponging, controlling bleeding in and around the incision, and closing the wound after the procedure is finished. This is called suturing.
What career opportunities will be available to me once I become a certified surgical technologist?
According to the U.S. Department of Labor's Bureau of Labor Statistics, the demand for surgical technologists is expected to grow much faster than the average for all other occupations through the year 2014. Most CSTs are employed in hospital surgery departments, obstetric departments, and outpatient surgery centers. However, there are many other employment options available to you once you gain experience. You may specialize in an area that interests you, such as cardiac, orthopedic, or pediatric surgery. You may be privately employed by a surgeon. You may want to become a traveling surgical technologist. You can become a surgical assistant. You may be employed by a veterinary surgeon or animal care facility. You may be employed as a sales representative for a medical instrument manufacturer. You may work in the material management or central sterile supply department of a hospital. You may take on supervisory responsibilities, such as an OR manager. You may also become a surgical technology instructor.